morning. The Senate Health, Education, Labor, and Pensions Committee will please come to order. Today, we are having a hearing on paid family, sick, and medical leave and what having paid leave options would mean for workers and families across the country. I'd like to thank Ranking Member Burr for working with me to hold this bipartisan hearing. And Senator Burr and I will each have an opening statement, and then I will introduce our witnesses, and after they give their testimony, senators will have each 5 minutes for a round of questions. Before we begin, I do want to walk through the COVID-19 safety protocols in place, and I again want to thank all of our clerks and all of our staff who've worked really hard to get this set up and help us all stay safe and healthy. We will be conducting this hearing following the same COVID protocols we have used in the past. Committee members are seated at least 6 feet apart. Some senators are participating by video conference, and while we are unable to have the hearing fully open to the public or media for in-person attendance, live video is available on our committee website at help.senate.gov. Given the new guidance from the Centers for Disease Control and Prevention and the Office of Attending Physician, I will be working with Senator Burr, our committee members, and staff going forward to follow the new guidance. Over the next few days, we will discuss with member offices, the Senate Rules Committee, and the Sergeant at Arms staff the best way to now operate our hearings going forward for senators and staff. For those in need of accommodations, including closed captioning, you can reach out to the committee of the Office of Congressional Accessibility Services. Paid leave is an issue that I have been focused on since I first got into politics. When I came to the Senate in 1993, the first bill we worked on was the Family and Medical Leave Act, which provided job-protected, unpaid leave to workers across the country. It was a hard-fought victory for families, but even then it was clear that bill was a first step, and we have been fighting since then to take the next one. Today, we are the only developed country in the world that does not guarantee paid leave. Nearly 1 in 4 mothers return to work within 2 weeks of giving birth. 1 in 5 retirees are forced to leave the workforce earlier than planned to care for an ill family member, and 4 of 5 private sector workers have no access to paid leave. The numbers are even worse for workers who are paid the lowest wages, workers who are disproportionately women and people of color. 19 out of 20 of these workers have no paid family leave. And studies show that while workers with disabilities may be more likely to need paid leave in order to care for their own health, they are less likely to have it since they are disproportionately part-time or low-wage workers. When this pandemic struck, we saw just how costly this has been for workers, businesses, families, and our country. Millions of workers were forced to choose between the well-being of themselves, their coworkers, and their families, or their paycheck. Millions were infected, millions more, especially women and workers of color, were forced out of their jobs in large part due to lacking paid leave or quality, affordable child care options. That is a tragedy that we can't afford, we cannot repeat, and we know we need to address. Last year, at the dawn of this pandemic, Congress included an expansion of paid leave in the COVID relief legislation. Now, that language was not permanent, and it wasn't nearly as comprehensive as it needed to be, but it was impactful. One estimate shows it cut infections by 15,000 a day in April of last year. As we look to learn all the lessons of this pandemic and make sure we are better prepared for future public health emergencies, one lesson is crystal clear. Our country needs a comprehensive national paid sick, family, and medical leave policy. We cannot rebuild a stronger and fairer economy if workers are forced to choose between their and their family's health or their paycheck. That's why I have joined Senator Gillibrand, who's long been a champion on this issue, in reintroducing the Family Act to provide paid family and medical leave to all workers. It's why I reintroduced my Healthy Families Act with Congresswoman DeLauro, so workers across the country can earn paid sick days and put their health first. And it's why I'm going to do everything I can to get the paid leave policy President Biden proposed in the American Families Plan across the finish line. President Biden's proposal would create a national, comprehensive paid family and medical leave program so workers can take paid time off to bond with a new child, care for a loved one who is aging, ill, or has a disability, deal with a loved one's military deployment, find safety from sexual assault, stalking, or domestic violence, heal from their own serious illness, or take time to deal with the death of a loved one. Providing paid leave is not radical. It's common sense, it is basic decency, and it's a public health necessity. Several states, including my home state of Washington, have already taken action to guarantee access to paid leave. It is well past time we make the same guarantee to all families in our country. When I spoke on the Senate floor back in 1993 about the need to pass the Family and Medical Leave Act, I shared the story of a friend of mine. Her employer told her she could spend time with her son, who was diagnosed with leukemia, or she could keep her job, but not both. That is an impossible decision no one should ever have to make. While providing unpaid leave was a step forward, the fact that in our country today, amid a pandemic no less, people are still forced to choose between a paycheck they need to make ends meet and taking time to care for themselves or their families, welcome a new child, or even grieve a lost one. It is unconscionable and it's unacceptable. It's bad for families, as any working mom or dad or anyone who cares for a family member with a disability knows all too well. And it is bad for our economy, as a lack of paid leave means employees lose wages, businesses lose workers. Studies have shown providing paid leave improves employee recruitment, retention, productivity, and morale, overall business performance, and profitability, and can reduce pay inequity for women and workers of color, which is why exactly it is far past time to make progress. And it's far past time we make paid leave a right for all, not a privilege for some. I look forward to hearing from our witnesses today about how important this is, and I hope to work with my colleagues on both sides of the aisle to finally make it happen. With that, I will turn it over to Ranking Member Senator Burr for his opening remarks.
Good morning, Madam Chairman, and thank you for scheduling this hearing. Welcome to our witnesses. It's also my hope that as the COVID guidance continues to evolve, that we will soon return to hearings that have witnesses and members here in person. And I'm pledged to work with the chairman to accomplish that. As a father, a husband, a grandfather, and a son, I understand the need to balance family life with the workplace. I support, and I believe most people support, being able to take time off of work when they're sick, their family member's sick, or after the birth or adoption of a child. I also support and encourage the idea of paid leave for workers. During my time in Congress, I've co-sponsored bills to help Americans earn more paid leave, such as the Working Families Flexibility Act, which would allow private sector employers to offer all employees who work overtime to choose between monetary compensation or comp time, just like the federal government allows. There are great benefits to providing paid leave. It helps attract talent, improve retention, increase employees' health and wellness, and it increases employee engagement. However, there are big questions of disagreement surrounding paid leave. Is it mandated? Who pays for it? Who gets it, and for what reason? Many of my colleagues are lawyers or have never had a job outside of government. It shows in some of the policy proposals they pursue. It's easy to come up with good ideas and tell someone else to pay for it. As my friend John Boehner used to say, everyone wants to be Santa Claus. So as we look at paid leave proposals, no matter how well intentioned, we can't just say to the private sector, now you need to pay for our extremely generous, brilliant ideas. Some large businesses currently provide paid leave and aren't looking for a new federal mandate, but instead want a common sense approach to help them deal with the varying requirements across different states. However, there are others that endorse a federal mandate. I'm skeptical this is a selfless act and worry that this is a form of corporate rent seeking where they're trying to impose cost or their smaller competitors to drive them out of business. Most small businesses already offer some form of paid leave because most people agree if someone is sick, they shouldn't be at work. But a costly new mandate imposing a one-size-fits-all policy of paid leave on small business can't be easily absorbed and could force business to cut jobs, not add jobs. If Washington wants to come up with the idea, Washington needs to pay for it with tax credits, subsidies, grants, at least for small business. The Family and Medical Leave Act of 1993 provides eligible workers 12 weeks of leave, but it does not have to be paid for. In 2017, thanks to Senator Fisher of Nebraska, Congress provided tax credits to encourage eligible employers to provide paid leave. I supported Senator Fisher's employer credit as part of the Tax Cuts and Jobs Act. This tax credit has now been extended through 2025. It provides a credit for eligible employees ranging from 12.5% to 25% of wages paid to employees for up to 12 weeks of family and medical leave. Employers must provide at least 50% of the wages. Senator Fisher deserves a tremendous amount of credit for pressing us to include that into the law. Also, the Families First Coronavirus Response Act, bipartisan legislation, supported by both sides of the aisle, provided businesses with fewer than 500 employees payroll tax credits for paid leave related to COVID-19 pandemic. These tax credits have been extended through September of 2021. Let's talk about the private sector leave programs. Job creators want talented workers and want to provide benefits for those workers. The private sector has many creative ideas to provide paid leave, such as paid time off purchase plans that allow workers who want more leave to purchase additional paid time off either through employer flex credits or salary reductions with pre-tax dollars. Others are providing short-term disability insurance to provide employees income security due to time off for injury, illness, or even pregnancy. Flexibility for the employer and the worker makes it work for all involved. State governments are coming up with paid leave plans of their own. For example, Senator Murray noted, Washington State provides a family and medical leave program funded through premiums paid by the worker and the employer, with the worker paying the larger share of the premium. Small businesses with fewer than 50 workers are not required to pay the employer premium. There's a lot of bipartisan interest in the Senate surrounding paid leave, including expanding the Fisher tax credits I've already mentioned. But we need to remember that we're really not good at running businesses from Congress. The one-size-fits-all approach does not work on issues, especially paid leave. So instead of pushing our brilliant ideas with arbitrary decisions made by Congress or bureaucrats in Washington, we should make sure we give business the flexibility to help employers make paid leave work. This is an important issue, Madam Chairman. I thank you for holding this hearing. I look forward to what our witnesses have to say.
Thank you very much. I will now introduce today's witnesses. Vicki Shabo is a Senior Fellow for Paid Leave Policy and Strategy at New America's Better Life Lab, where she works closely with policymakers, advocates, researchers, and business leaders on policy design and strategies to advance paid family, medical, and sick leave for workers and families. Welcome. Thank you for joining us today. Next, I'd like to introduce Marcia St. Hilaire Finn, who is the founder and owner of Bright Start Early Care and Preschool in Northeast Washington, D.C., which has been in operation since 2002. Welcome. Thank you for being here. Next, Marianne Mcmanus is the Vice President of Health and Benefits at IBM and recently served as Chair of the American Benefits Council Board of Directors. We're glad to have you here today. Finally, I would like to introduce Beth Molito. She is the Senior Executive Counsel to the National Federation of Independent Business, served in her role since March of 2004. Thank you for joining us today. We will begin with Ms. Shabo for your opening statement.
Thank you so much, Senator Murray, and thank you for your tireless leadership on paid leave well before the pandemic and for this last very difficult year. And thank you so much, Senator Burr, for having me here today as well. The pandemic has shown us nothing, if not that we must address holistically how we care for ourselves and one another. I want to touch briefly on paid sick days, paid family and medical leave, and FMLA. First, paid sick days. In March of 2020, just 25% of workers in private firms and nearly 70% of low-wage workers did not have a single paid sick day at their jobs. These are disproportionately workers in food service, retail, janitorial services, many of the same workers who are on the front lines of this pandemic as essential workers. For these and others, just 2 to 3 days away from work jeopardizes their ability to buy groceries for a month, pay gas, pay utilities. 7.5 days risks a month's mortgage or rent. For many, multiple sources of structural racism and economic inequality create health disparities that layer on top of less access to paid sick days, creating multiple barriers to closing health and even educational equity gaps. Fortunately, when COVID hit, as you mentioned, you and your colleagues created the first ever paid sick time standard, committing public funds to preventing the spread of the virus. COVID emergency paid sick leave is estimated to have prevented more than 15,000 cases per day nationwide. But that emergency paid leave requirement for some businesses and some workers expired at the end of 2020, and now we have reverted to no guaranteed paid leave, even as the virus continues to ravage us in some parts of the world and also in spikes here, and as people need access to vaccines. Access to paid sick days is associated with better preventive health, lower rates of community disease spread, fewer workplace injuries, and more efficient use of healthcare resources. And as I prepared for this hearing today, I marveled at the amount of research that's been amassed over the past several years as more and more experience with paid sick days has been had in states and cities. Access to paid sick days, correspondingly, is not associated with negative job consequences, business consequences, job loss, price increases, or reduced employee benefits. The Healthy Families Act, which would allow workers to earn up to 7 paid sick days each year, is a key solution and would replicate the paid sick time that federal contractors have been obligated to provide since 2017. And notably, since the pandemic hit, 3 new states have adopted paid sick days laws, joining nearly a dozen others and 24 localities in creating baseline earned paid sick days standards. Yet everyone else is left behind. It's time to change that and guarantee paid sick days to all working people. Unpaid family and medical leave. COVID also brought home workers and families precarious situations when babies and children need care or a serious personal or family illness strikes. In March of 2020, just as the pandemic hit, 1 in 5 private sector workers, just 1 in 5, had access to paid family leave through their jobs. And there are huge disparities. 38% of higher wage workers had paid family leave, but just 5% of low wage workers did. Just 2 in 5 had access to employer-provided temporary disability insurance for a personal medical leave lasting weeks or months. And again, we see the disparities replicated. And overall, these numbers mask dramatic and growing inequalities. Over the past 10 years, paid family leave access for high-wage workers climbed by 20 percentage points. For low-wage workers, just 2. That's unacceptable. The country's failure to address paid leave has macroeconomic consequences in terms of reduced GDP and lower labor force participation. It costs families an estimated $22.5 billion annually in income, or more than $9,000 for a typical family who needs 3 months of leave, which means less money circulating in local economies and communities, as well as hardships within individual households. Lack of paid leave reduces mothers' earnings and means hundreds of thousands of dollars lost in older workers' income and retirement savings. It means more public dollars spent through Medicaid for nursing homes and more resources for SNAP and other public assistance programs. Too often, critics ask, how can we afford a national paid leave program? But the truth is that we're bearing enormous, unaffordable, and unsustainable consequences of the status quo. The comprehensive paid family and medical leave proposal in the American Families Plan, the Family Act, and Chairman Neal's Building an Economy for Families Act all present workable paths forward. They reflect models from 10 states, including Washington and Washington, D.C., and would make public investment in paid leave for all working people, no matter where they live where they work, their job, or their serious personal family and medical need. Finally, the FMLA, and I know I'm running short on time, so I'll try to wrap up. The Family and Medical Leave Act, which offers job protection and health benefits continuation, covered just 56% of the workforce, meaning more than 4 in 10 workers are left out of job protection. This is disproportionately Black and Latinx workers, low-wage workers, and single parents. And now with the pandemic's effects on employment for these very same groups, coverage is likely to be even lower. Congress must expand job protection and must do so to match any paid leave program it creates so that workers can use the paid leave that will be made available. And Congress must never create paid leave protections that merely align with today's FMLA or will simply replicate the same inequalities and inequities and the same disparities that we have now. I leave you with this. This hearing is titled with the words "working families" in it. Paid leave rewards work, it strengthens people's attachment to the workforce, it promotes employee retention, it allows people to care for themselves and their loved ones. But at the end of the day, it's really about values like love and responsibility and care and dignity. It's about people like April Kimbrough, who lost her job and her home when she had to go care for her son with kidney cancer. People like Felix Trinidad, who died 8 years ago of stomach cancer because he didn't have a sick day and then had to work through chemo at his grocery store. He left behind a wife and 2 small children. And it's people like Ms. St. Hilaire Finn, who we'll hear for, and business owners too, like Sarah Piepenberg, who fell behind on her own home and business payments in order to provide paid leave to an employee who had broken both arms. Paid leave must be an essential element of economic recovery, and there is no time to lose. Thank you.
Thank you very much. We will turn to Ms. St. Hilaire Finn, please.
Thank Chairman Moray, Ranking Member Burr, and members of the committee. Thank you for the opportunity to testify today. My name is Marcia St. Hilaire Finn. I am the founder and owner of Brightstart Early Care and Preschool in Washington, D.C., and a member of the Main Street Alliance, a national network of more than 30,000 small business owners. Launched with just 2 employees, my business have 3 locations and 3 employees by the end of the summer. 30 years ago, I came to the U.S. from the Eastern Caribbean island of Dominica for a career in nursing. I started Bright Start in 2002 after seeing there was no nearby childcare center to fit my unique schedule and provide quality care for our daughter. Early on, to attract the best employees, and despite the cost, we provided 1 week paid sick time and 2 weeks paid vacation. I've since added partial health insurance and more paid and unpaid leave and vacation time. As a result, we have extremely low turnover and our children benefit from being with the same staff. But even with a business model that relies on private pay and higher fees, I can't meet my employees' full needs. Many other small businesses are from industries and places where it's even harder. Small employers generally don't have the capital to provide paid leave on their own. That's why most small business owners support a national paid family and medical leave program and common sense national standards for sick days. As a registered nurse and childcare provider, I know firsthand the benefits of paid sick days that let employees stay home and out of the workplace where they may spread disease. DC was the second city in the country to pass a paid sick day law. We had no trouble with the new policy, which is the typical business experience. Studies of cities with sick paid policies find that most business owners have few difficulties and support the program once it's in place. But sick days aren't enough. I've had employees who needed more time off, several to welcome a new baby, and 2 for cancer treatment. I held their jobs for them and cobbled together what I could. After they exhausted their 4 weeks of paid time off, I provided unlimited unpaid leave. When needed, I arranged for partial advances on their salaries. These employees say they recovered more quickly just knowing they could take care of themselves with a job to come back to. They returned even more energized. But I've also had several staff members who took less time than needed because they couldn't afford unpaid leave. Our paid leave policy was the right decision, but not an easy one. While these employees were out on leave, I paid for their leave and additional staff. That's why I strongly support a paid family and medical leave program in the district. We now have access to a public insurance option with small predictable costs and up to 8 weeks paid leave. If an employee needs to take leave, the program pays their wages so I can use that money for overtime for an existing employee or new temporary hire. The DC program also provides an expanded family definition which better meets the needs of today's families. And the public administration of the program takes that task off small business. Overall, this helps level the playing field for small businesses with larger companies. Then came COVID. Last fall, I had to close one center for 10 days to quarantine our staff when we had an exposure. Families First was a lifeline. I could have kept paying for staff while they were out all at once because of our public health measures. I couldn't have afforded this on my own. While Families First was essential, it has challenges and should not be the model for a permanent paid leave solution. Tax credit programs rely on businesses applying for and administering the program. For willing, well-connected business owners with payroll and HR services, this can work. But a typical small business like mine doesn't have these support systems. Public programs are easier for both employees and small employers and should be the model for national paid leave. This past year has been one of the most difficult ever for my business and for most small businesses, particularly childcare centers across the country. We've been given a wake-up call. We need bold investments in our care infrastructure to get on the path, not just to recovery, but resilience. Thank you for the time and attention. I look forward for answering your questions.
Thank you very much. We'll turn to Ms. Mcmanus.
Good morning, Chair Murray, Ranking Member Burr, and esteemed members of the committee. I'm Marianne Mcmanus, Vice President of Health and Benefits at IBM. I'm responsible for overseeing global benefits design, strategy, and delivery, along with corporate health and safety guidance across IBM globally. Today, I'm here on behalf of the American Benefits Council to communicate our support for federal paid leave legislation so that all workers in the United States have access to robust paid family, sick, and medical leave benefits. At IBM, we've long recognized the vital role these benefits have in the lives of our employees and continue to believe that paid family, sick, and medical leave are essential. This past year, the COVID-19 pandemic underscored just how critical paid leave policies are for our workforce's health and well-being, particularly as it becomes increasingly mobile and remote. Our challenge is not in providing paid time off benefits to our employees. Instead, the challenge is created by the patchwork of inconsistent state and local laws, the speed at which new regulations are changed and introduced, and the volume of requirements applicable to nationwide operations around the country. IBM and our fellow council member companies all agree that we are most successful in recruiting and retaining top talent when our employees do not have to choose between their careers and caring for their health and their families. But due to varying state and local mandates, we inevitably have different processes that employees must follow and different benefits depending on where they work. Today's policy model doesn't allow for consistent and uniform benefits for all employees. This isn't just a matter of the unnecessary costs and administrative burden for employers. It's a matter of fundamental fairness and equity for employees. It can be overwhelming and confusing for employees to determine which laws apply and what benefits they're already entitled to. Here's a concrete example of the challenge. Prior to the pandemic, an IBM employee in San Francisco could be covered by as many as 4 laws simultaneously addressing the duration and amount of paid leave available to them for their illness or the illness of a covered family member. The state paid sick leave law, the city's paid sick leave ordinance, the state paid family leave law, and the federal executive order on paid sick leave. During the height of COVID-19, that employee was covered by 2 additional laws, both the state's and the city's public health emergency paid sick leave law. The challenge posed by having to navigate 6 or even 4 different applicable laws simultaneously is significant for employers and employees alike. We recognize that not all workers have access to generous paid leave benefits, and that there are challenges for many small businesses or certain types of employers in providing these benefits. The federal government's essential role in filling the gaps nationwide for organizations of all types and sizes can be done while building on effective employer benefit programs. In our view, a federal legislative solution that provides employers a single set of standards nationwide would advance employee equity while eliminating confusion for employees and cumbersome compliance burdens for employers. A federal solution should offer all employees consistent benefits, regardless of where they live or work. At IBM, we believe this era of technology and innovation is powered by our employees' hard work and creativity. We strive to provide our workforce with the flexibility and benefits they need to do their best work. The best outcome for the American workforce would be a balanced solution, as I've described today, one that allows employers to offer innovative and competitive benefits that are valued by their employees in a consistent, equitable manner nationwide. We applaud the committee for focusing on this challenge, and I thank you again for the opportunity to testify. I look forward to answering your questions.
Thank you very much. We will turn to Ms. Molito.
Thank you, Chair Murray and Ranking Member Burr, for inviting me to speak today. I also thank the other committee members and staff who are in attendance. My name is Beth Molito, and I'm an attorney in the National Federation of Independent Businesses Small Business Legal Center. NFIB is a member-driven organization that represents about 300,000 small and independent businesses across the country. Small businesses employ nearly half the country's private sector workforce, and when small businesses succeed, communities and local economies succeed. Consider the very type of small businesses you frequent: pizza parlor, auto shop, dry cleaner, hair salon. Some have employees that are strictly full-time, others strictly part-time or hourly. Some have both. These are the typical NFIB members who employ 5 to 10 individuals. Only about 12% have a human resources professional. The business owner or spouse is often the HR point person. Over 50% of NFIB members still do payroll in-house. I describe our membership to illustrate one of the key points of my testimony. There is no such thing as a one-size-fits-all policy that works for every business or every industry. I understand the good intentions behind various proposals to mandate leave, but NFIB and its members have long opposed leave requirements for 2 reasons: inflexibility and cost. First, innovation and flexibility are critical to small business survival. The COVID-19 pandemic showcased small firms that thrive by innovating, pivoting, and adapting to their new circumstances. Small firms depend on flexibility, not only to boost sales and manage business operations, but to establish employee benefits, which includes paid time off. The majority of small businesses provide flexible, mutually beneficial arrangements that allow employees time off when necessary in a fiscally responsible way. Small business owners recognize the value of providing paid leave to employees since, after all, small businesses need to bid for and retain talent just like all other firms. And to the extent that they can, small businesses provide paid leave voluntarily to remain competitive and attract talent. Currently, finding qualified workers is the #1 cited problem for small business owners, surpassing taxes and regulations. And one of the primary ways in which small businesses attract and retain workers is by providing flexible leave policies that fit the needs of their employees and the businesses. To the extent that small firms do not offer paid leave, this reflects the reality that some small firms simply cannot financially afford to offer this benefit. If you can only afford to give your workers 10 days of paid time off and the government mandates 5 days of paid sick leave, then your employees have only 5 days left for vacation. This leads me to my second concern with leave mandates. Leave, paid or unpaid, is not a free benefit for employees. The unanswered question with a leave mandate is, who is going to pay? There's a cost with these proposals, and not all business owners can absorb the cost. In a small business with a finite amount of resources, this means less money available for wage increases, health insurance, and hiring additional employees. It also means more time and money devoted to complying with workplace laws. I mentioned earlier that small business owners typically have few administrative staff and little human resources experience. Nearly all leave proposals, paid or unpaid, would impose record-keeping requirements, including leave tracking, accrual, notification, documentation, and reporting. When one state considered and adopted a paid leave proposal a few years ago, the legislative record was replete with opposition from small businesses. And consider this submission from a business owner. Quote, we compete in a world market, and everything the state or federal government does burdens us with more and more unfunded mandates that make us less competitive in world markets. So now I have fewer employees, and since there is not enough income after all my employment costs are met, I end up not getting paid anything for my family for all the work that I do. I could go on, but the bottom line is that we farmers don't make enough to subsidize all the wonderful benefits that you would like to see employees entitled to. I have workers asking for work, and there is plenty for them to do, but at the high cost that the state requires me to pay, I have to limit the number that I can hire. It may seem great to mandate more benefits to employees, but the hidden costs are fewer jobs. Small businesses generate 40% of U.S. economic activity. So the fundamental truth is we need small businesses to stay alive in order to maintain a healthy economy. 14 months after the outbreak of the pandemic, the small business economy remains fragile, and mandated leave laws represent a significant challenge for small businesses. Mandates are generally not flexible nor affordable. On behalf of the small business owners of NFIB, thank you again for inviting me to appear before the committee.
Thank you. We will now begin a round of 5-minute questions of our witnesses, and I again ask my colleagues to keep track of your clock. You can stay within those 5 minutes. Ms. Szabo, let me start with you. The pandemic has disproportionately harmed essential workers, and in particular, essential workers who are women, people of color, people who are paid low wages. And they face higher rates of illness because they can't work from home. And many, especially in our low-wage sectors, do not have access to paid sick days and paid family leave and medical leave. Based on your expertise, how would have a national policy ensuring access to paid sick days and paid family and medical leave impacted workers and the economy during this pandemic?
Thank you for that question. I think the evidence and the answer is clear that there would have been multiple effects. First of all, for all of us, COVID would have been reduced. We already know that the Families First Act reduced coronavirus by 15,000 cases per day, and that's even with a law that only applied to somewhere between 25 and 50% of the workforce. So imagine
because people stayed home and didn't impact.
Exactly. Then, survey after survey from the Kaiser Family Foundation and the Bipartisan Policy Center has shown the share of workers, and it was significant. It was around 30%, who lost a job or left a job because they were scared of getting sick in their workplace. So some of that obviously had to do with PPE, but some of it had to do with lack of access to paid sick time if they got sick. We know that women in particular took unpaid sick time disproportionately, both to care for children who were out of school and to deal with the care of a loved one. And that has translated, of course, in part into 2 million women who left the workforce and haven't yet gone back. We know that especially pregnant women during this time faced really terrible choices between being able to continue to work and caring for themselves and the health of their pregnancy. And then what did they do with the newborn when child cares were closed? So myriad problems that could have been solved by having a national paid sick days and national paid family and medical leave program in place. And workers knew that, voters knew that. Asked whether a national paid leave program would have helped them through the pandemic, an overwhelming majority said yes, and there were no divides really across party lines because everybody was affected by this pandemic and has been affected for years before. And that's why we've seen high levels of support for both of these policies, 70 to 80%, with very little partisan division over the last decade, really.
Thank you. I agree with that. Ms. St. Hilaire Finn, you have run a successful child care and preschool business here in Washington, D.C. for over 17 years. Over the course of that time here, Washington, D.C. put in place citywide paid sick days and paid family and medical leave programs. Based on your experience with the city's paid leave policies, tell us how you believe a national paid sick family and medical leave policy affects childcare providers and other small businesses.
Thank you, Chairman Murray, for the question. I think a national program would level the playing field for small businesses, that businesses won't have to charge a premium for them to afford a national paid leave. Also, I think that paid leave would ensure that workers stay home when they're sick. As a healthcare professional, we see people come to work sick, and many times I have to encourage them to stay home. With a national paid leave, they will know that they can stay home, concentrate on being well, and receive pay. They won't have to choose between their health and a paycheck. Also, it also helps us to value employees. It helps us to retain the best and the brightest. Like it's been said, most people today are looking for a place where they can call home, that they know that when they come in, that they can do their best, and when they are sick, they can stay home and take care of their health. The fact that women also shoulder most caregiving, paid leave would make it easier for women to take care of their needs and return to work when they are much better. And both programs, paid family leave and paid sick leave, would also help boost the economy, because a parent staying home when they're sick can return and be functional at full capacity, providing the best to the economy. Thank you.
Thank you very much for that. Senator Burr.
Thank you, Madam Chairman. You know, this is fascinating because nobody's opposed to family leave. All of our witnesses speak in favor of it, and I heard a couple of references to the COVID example. And it makes me think about the innovators who really responded to something that didn't exist just a year and 2 months ago. Those small incubator companies that came up with diagnostic tests, they came up with therapeutic responses. I'm not talking about the Pfizers and Modernas, big companies, but I'm talking about the small ones that had the flexibility to work with technology. And I wonder if they had this series of regulatory mandates, would they have even existed then? Would they have been able to respond to this? In many cases, their employees are made up of employees that have chosen to work overtime because they're trying to make a company succeed. And in some cases, they've sacrificed pay for some type of stock benefits. Those employees with that company have made certain decisions about their finances because they want the company to be successful. That's their livelihood. And Marcia, your business is a great model. You serve a very special clientele. My grandchildren potentially could be there. But I also remember that downstream from you are the parents of these children that are working for a small business that may have been represented by NFIB, and that your success is reliant on their job and their employment. And if, in fact, their employers can't stay in business, then who's going to pay you for the child care? They're probably going to miss out on the educational experience of early childhood learning. And so I've got a question to Ms. Mcmanus and Ms. Molito. It's been stated today that a national plan is the answer. However, national plans don't seem to ever be all they intend to be. They don't run so well. Look at Social Security as an example. A national solution does not necessarily mean new national mandates or new federal entitlement programs. A national plan could mean we make it easier for the private sector to do their job, such as providing tax credits for COVID-19 relief. A Pew 2017 survey showed great support for family leave, but most of those surveyed think the employers should provide it, not the government. So my question is this: what could the federal government do to reduce red tape or provide incentives to make it easier for employees to provide paid leave benefits? Let me go to Ms. Mcmanus first.
Thank you, Senator, for the question. I think, as I said in my oral testimony, our view is that what is needed is a federal solution that would provide a sort of level playing field for employers and all American workers to have access to paid family and medical leave benefits. But we do think that there's lots of room for many components to that solution. We believe allowing employers the flexibility to leverage private sector solutions and keep doing what they've been doing. I think you mentioned incubators, right? Creative incubators. Allowing employers to continue to do that is great. We see that there's lots of activity at the state level, and that may have a role as well to play, because we recognize that not all employers are IBM, or not all employers are members of the American Benefits Council. It may take incentives. That may be another tool in the toolbox to help employers be able to build the types of leave programs that would meet a federal standard. So, we're in complete agreement. We think it's needed. We think all American workers need these types of benefits. And we think that building upon what is working today, which is, private sector solutions, but having a federal standard in place really would be the most practical way to get at the
I want to
issue.
get to Ms. Molito before my time runs out. Not all states are California, too, Ms. Mcmanus. Ms. Molito?
Right. Thank you very much, Senator Burr. So small business owners get the changing dynamics in the workplace. They are parents and caregivers too. But flexibility is key. So in considering leave proposals, we would certainly ask that you consider the impact that a proposal would have on small businesses, just as Congress did in 1993 when it exempted small employers from the mandate of the Family Medical Leave Act too. And as Congress did last March in the Family's First Coronavirus Response Act with regarding to expanding the Family Medical Leave Act, that same 50 employee exemption. And Senator Burr, just real quickly too, you outlined some possibilities in your opening statement too, which I thought, Senator Fishman's tax credits were helpful too. And there are other flexibility arrangements, expanding comp time, those sort of things that would also be helpful in allowing employees the time away from work that they need.
I thank you. Thank you, Madam Chairman.
Thank you. We'll turn to Senator Casey.
Thank you, Chair Murray. I wanted to start by asking consent. Madam Chair, I'd like to ask unanimous consent to include in the hearing record 4 letters, and these letters are from, one is the 100 Days Statement, the second is the Center for Law and Social Policy Statement, American College of Physicians Statement, and fourth, Maternal and Child Health Organization Statement. These are 4 statements from roughly 120 experts, organizations, and advocacy groups supporting the need for comprehensive national paid leave policies. Thank you, Chair Murray. I wanted to start with the question of access. I'll direct 1 or 2 questions to Ms. Szabo. The access question, I was struck by one number. There's so many numbers to contemplate here in terms of where we are as a nation. But one number just kind of leaped off the page when I was reading a memo preparing for the hearing. It's 20. It's obviously many numbers we can talk about, but 20%. 20% is the percent of private sector workers that have access to paid family leave. Now, I know we're not only talking about family leave, we're talking about leave generally, paid leave generally. But just in that one category of paid leave, family leave, 20% of private sector workers. That's where we are today. I don't think anyone can be and is satisfied with that. So, Ms. Szabo, I wanted to start with this question about gaps in access that are obviously driven by distinctions between what happens to a worker and a low-income worker and a higher-income worker. We also know that workforces that currently lack access to leave are disproportionately women and people of color, as you and others have testified to. And as we work to create a national approach to these challenges, it's critical that these programs reach the people that we hope they would reach and are structured in a way that would allow workers to fully take advantage of them. In your testimony, you discussed how important it is for programs to be designed to encourage take-up and how important outreach to workers and families to expand awareness of the program. So if you can talk about that. Number one, how to design paid leave programs, and secondly, how to conduct public outreach to best ensure that workers who need them most will fully utilize them.
Absolutely. Thank you for the question, Senator Casey. And I, too, remain very compelled and disturbed by that 20% figure, and particularly that by the 5% figure for low-wage workers, which has only gone up by 2 percentage points in the last decade. So to your question, we know from the state programs, and there are now 10, 7 of them are in operation, we know that there are better and worse ways to design these programs. So high wage replacement for low wage workers, the newer programs, Washington State, the District of Columbia, Massachusetts, and others all have higher wage replacement for low wage workers so that they can afford to take the leave that's needed. Employment protections. You know, we've talked a lot today about the 50 employee carve out in the FMLA, but what that does is disproportionately carve out low wage workers, workers of color, single parents. Particularly in light of the pandemic, that will be the case. And the Families First Act, which included the ability for small employers to deny leave to their workers, their parents who needed leave, that, according to the Health and Human Services Department, disproportionately excluded single parents and low-wage parents as well. So we need to make sure that job protection is in place. We need to make sure that wages are high enough. For wage replacement is high enough. We need to make sure that leave taking is available on a gender equal basis. We know that men are more likely to take leave when paid leave programs are in place, particularly when benefits replace a substantial share of income. On the outreach and education question, we've learned a lot about the design of forms to make sure that application processes are clear. So my colleagues at New America did a whole project on that, and others have as well. We need to make sure that there are resources available, outreach to both employers to help them understand why these programs are beneficial to their workers and to them, as well as outreach to workers through community-based organizations, health centers, and others. With the state paid leave programs, what we've seen actually is not that there is overuse of these programs, but that there is underuse, and it's often because the very workers who could benefit most don't know that these programs exist. And lastly, you know, just on this point of business that's come up, study after study from California, New Jersey, Rhode Island, and now New York show that actually businesses, small businesses, those under 50, those under 100, are overwhelmingly supportive, that they have benefited. They say it's easier to navigate the long leaves that their employees might need when they need them. So we know a lot, and there's a lot of work to do to help those 80% of workers that don't have access to paid family leave now.
Well, thanks very much. I'll submit a question for the record, and it'll focus on the benefits to children, to older workers, as well as people with disabilities. But Chair Murray, thank you for the time.
Thank you. Senator Cassidy.
Yes, thank you all. Ms. Chabot, and again, I've been monitoring 2 other committee hearings, so if I'm asking something that someone else has asked, I apologize. But I gather that you would finance your paid leave with a payroll tax. Now, what we've seen in some states is that, say, Google in California is providing a benefit, and when California comes in the state and provides a benefit, all Google does is pull back upon their contribution and allows the state to pick up that which formerly Google paid for. On net, I'm sorry, I'm a doctor, so I always think this way. The beneficiary doesn't get any more money. It's just that which was formerly paid by a Fortune 10 company is now being paid by taxpayers. Any thoughts about that?
Yes, I'm so glad you asked the question, Senator Cassidy. I know this has been a concern for you. I think the evidence overwhelmingly shows that in states that have adopted paid leave programs, we haven't seen the benefits be reduced. In fact, Google, Facebook, the tech giants that have led on paid leave benefits haven't reduced their offerings.
But on net, it's just on net, does the beneficiary get the state plus what they were formerly getting from the business? Or is it that
I believe Google and
reduced?
Facebook, right, I think they self-insure actually, so they don't draw on the state program at all. It was struck
that's not what I've been told by others in another committee hearing, that there is a reduction in the amount that the company puts up subtracted by the amount that the employee would receive from the state program. Are you saying that's not true, or that you're not sure about that?
Well, we should look into that, and I can get back to you on it.
So there was testimony in a Senate Finance Committee hearing last year, which established that and we can reference that. I say that because, again, the payroll tax that you're suggesting would be highly regressive. But also, I've been thinking a lot about how do we bail out Social Security and Medicare. If you need to expand payroll tax to bail out those two programs, in a sense, you've cannibalized the capacity to do so by already raising it for a new mandatory benefit. What thoughts do you have about that?
Well, it's true that the state programs are financed through payroll taxes. That is one model that's possible for Congress as well. There's other revenue sources that are on the table right now. But I think, the state experience has shown that this very small payroll taxes that are levied on employers or both come back in spades to benefit both workers and employers.
So let me just ask, though, because right now the payroll tax on the employee is for Medicare is like 7.25%, and an equal amount upon the employer. I gather what you're suggesting, though, would be an increase of that amount. So it's been very hard to raise 7.25% to 8.5%, for example, with a total, twice that if you include the employer's contribution. How much do you imagine we would have to increase payroll tax if payroll tax was the funding mechanism for a plan such as yours?
I'm glad you asked that question. So the Social Security actuaries last year looked at the Gillibrand-DeLauro bill and estimated that it would be a 0.62% payroll tax increase, so less than 1%.
So that'd be 0.62 on the employee and then
No,
the
total.
0.62% on the employer.
Social Security actuary said it would be total 0.62%, which is very consistent with where the states are in terms of their payroll taxes. And that includes having the Social Security cap be the wage base. So
the Social Security cap being what? I'm sorry.
The wage base for that 0.62. So you could bring it down even further by using the Medicare cap instead of the Social Security cap.
Now, and to my question of whether or not we're cannibalizing our ability to address the shortfall in the Medicare and Social Security funds, which are going bankrupt within 5 or 6 years or 10 years, depending on which fund you're talking about. And so this is a clear and present danger, if you will. Do you feel as if, I'm just asking, that the amount that we're putting up to this new mandatory benefit would not impede the ability to perhaps further raise payroll taxes to bail out these two programs?
I don't think so, because we're going to be looking at people who have higher wages, higher workforce participation, more revenues coming into the Social Security Trust Fund and Medicare as a result of higher wages and more people working. So I think
So in a sense, you're dynamically scoring this, imagining that there would be, despite raising taxes, there would be even more employment, even though typically when you raise taxes, you have less employment because employers seek increases in productivity to offset the increase in taxes.
Well, yeah, and here we're replacing the income of people who are working and getting them back into the workforce. We're enabling jobs for people who might have to leave work otherwise. So I think this is a different case, and I think the question is, how can we afford not to do this? If we were to finance through payroll taxes, it would be a small cost for a big value, especially for those 80% of workers that don't have paid family leave right now.
I'll finish with this because I'm out of time. Thank you, Madam Chair. Just by saying it does concern me that if Google and other big companies are currently providing this benefit, and if by increasing or having a mandatory federal benefit, that would just allow them to offload their obligation upon the federal taxpayers. That is a subsidy of the less well-off for those who are much better well-off, not the least of which would be a huge company. So with that, I yield back. Thank you.
Senator Kane.
Thank you, Chair Murray and Ranking Member Burr, and thank you to all the witnesses. This is a really important topic. Chair Murray, to begin, I have 3 letters for the record that I'd like to introduce. The first one is a letter from 307 business and management school faculty from 139 universities. The second is a letter from the Network Lobby for Catholic Social Justice, and the third is a letter from the Interreligious Working Group on Domestic Human Needs. When we were prepping for the hearing, I just asked my staff, hey, just find what we're hearing from Virginians about this, just who's writing in. And I just want to offer up some thoughts from them. Kelly in Chesterfield County, which is in suburban Richmond, she was off work for 6 years to take time out of the workforce to care for her 2 young children. And then she started back to work after 6 years. Her youngest child kept getting sick because she'd never been in a daycare setting before then. Kelly tried to negotiate with her employer, flex schedule, work from home. She was denied. She was forced to use up her limited personal time off, which went very quickly because of her children's various illnesses, including a stay at a local emergency center. As her personal leave dwindled and the prospect arose of having to take unpaid leave, she was laid off from her job. Shamilla in Fredericksburg, she became paralyzed due to an underlying health condition right before COVID hit. She was employed full-time. She was able to go out on short-term disability, but she ended up being hospitalized for over 7 months and was in a wheelchair. When the short-term disability ran out, her job was unable to accommodate her, so she applied for unemployment but was deemed ineligible. Her husband became her primary caretaker in the absence of paid leave. He used up his paid time off and then all the extra unpaid leave to get her to all her doctor appointments. Now they're behind on mortgage payments. Son had to drop out of college, depleted most of their savings. Shamilla has been lucky enough to get a new job that allows her to work from home, and she is now able to walk, but she still faces serious underlying health issues. Kind of a different take on this, Amanda in Norfolk, for the most part, she didn't need paid sick leave for herself. She needed it for other people because she worked in restaurants and bars. In those years, she worked with fevers, coughs, cold, bronchitis, strep throat, and really just any of the other unnamed infections because she didn't have health insurance during some of those years. So she didn't go to the doctor unless there was imminent threat to her life. At her job, Amanda preps food, makes tea, coffee, folds napkins, rolls silverware, serves food, pours drinks, made desserts. This is her word. If it's going into your mouth or across your face, I had my hands on or near it. Working while she was sick was less detrimental to her than it was unpleasant, uncomfortable, even dangerous for the people that she served. And finally, Lee and his husband Randy from Alexandria were on vacation in 2018 when Lee noticed lower back pain, went to see an orthopedic surgeon. At first, the surgeon recommended physical therapy, but they needed an MRI that showed a tumor. Kicked off a flurry of hospital visits, scans, and appointments with specialist time in the hospital. In the aftermath of this, had a heart attack due to a blood clot. But the good news is both Lee and Randy had paid family leave at their employers, and so they were able to take care of their health without worrying about losing their jobs. So these are just 4 of the many stories that I hear. 2 are about the lack of paid health leave causing somebody to lose their savings, to lose their job. 1 is the lack of paid health leave causing somebody to go to work sick and potentially endanger others. And then the 4th is a good news story about what paid family or paid sick leave can do. My understanding, Ms. Shabe, I'll direct this to you. The U.S. is the only country in the OECD that doesn't have national paid leave. According to a 2014 International Labor Organization report, out of 185 countries and territories with available information, only Papua New Guinea in the U.S. did not have national policies providing paid maternity leave. On paid sick leave, the U.S. is the only country with a high living standard based on the UN calculation of what that means without a national policy guaranteeing workers paid sick days. What does it say about our values when we are so out of step with nations around the world who think it's good for workers and also good for the people they serve to not have to come to work when they're sick?
Yeah, I mean, this is a question of value. It's a question of economics. It's also a question of values. We talk a lot about how we care for ourselves. We've just come through an unprecedented pandemic where the need to care for oneself and one's loved one couldn't be clearer, and yet 80% of workers don't have paid family leave, 70% of low-wage workers don't have a single paid sick day. And we are an outlier, as you have said, on paid maternity leave, paid parental leave, paid family care leave, and paid sick leave.
Thank you, Ms. Shabe. I'm over time. I yield back, Chair Murray.
Senator Romney.
Thank you, Madam Chairman. You know, a number of Republicans Senator Rubio and myself and others have introduced legislation that would provide for paid maternity leave, but do so without imposing new costs on taxpayers or employers. In our case, we allow people to draw from the Social Security Fund and then to ultimately pay that back through lower benefits down the road at a time when they're less in need of the funding. You note that this isn't a big increase, 0.6%, but for family earning $40,000 or $60,000 a year, it's $400, and that's a big increase for that family earning $600,000 a year. And I mean, it seems like a small percent because when government thinks about raising taxes, it's always a small percent for us, but it's a very substantial change in the living standards of our citizens. Why not consider measures that would allow us to provide paid maternity leave that don't place additional tax burden on employers and employees?
I assume that question is for me. Yeah. Well, thank you for the question, and thank you for your interest in the issue. I have looked at your proposal and appreciate the contribution to the dialogue. So a couple of concerns that I have. First, your proposal would cover just leave for new parents, which is only 25% of people who need access to paid leave in a year. Most people use it for their own serious health issue. Another 25% or so need it to care for a family member who's sick. On the merits itself of the policy, while I appreciate the intent, what will happen is that those workers who choose to take paid leave when a child is born will then have to work longer, and they will take a lifetime benefit cut. So the amount that you're talking about, the small contribution that you would make under the Family Act model, would help those families who would otherwise lose an average of $9,000 when they need to take a paid family or medical leave. They would have access to a family leave benefit that would allow them to take leave for a multiple number of purposes. Two, these are the very same people, women in particular, low-wage workers, who have lower lifetime Social Security, lower earnings, which means lower Social Security benefits. So these are the very people who can't afford a lower Social Security benefit when they get to retirement, and they may be in very physically taxing jobs so that they're not actually able to delay taking their Social Security benefits when they get to retirement. So again, I appreciate the intent, but I worry that the very same people who are going to need paid leave when they have a new child are also the people who need more robust retirement security when they get to that part of their lives. And I don't think we need to ask those people to trade off against themselves. I think we can create a program.
As you know, there's also provision for people to add to their working life as opposed to a retirement at the same age, but a little longer period of time. The challenge, of course, is that if every problem we deal with is simply by raising taxes, why we end up burdening the American taxpayer. We violate the president's pledge not to raise taxes on people earning under $400,000 a year, and we depress the economic growth, which allows people to have good jobs and rising wages. With regards to child care and the need for kids to have child care, broadly speaking, looking at the Democratic proposals with regards to child care, there seems to be a very significant bias toward providing child care and pre-K education and so forth, which encourage, if you will, women and men going into the workforce, as opposed to saying, hey, if one of you wants to stay and raise the child, that's acceptable too. It does seem like the administration strongly prefers getting kids out of the home and getting both parents into the workforce. And I understand there's an economic reality to that or advantage to that. And yet I also think there's a developmental advantage to a child if parents want to have one or both remain home to raise a child, that there's a child-rearing advantage to that as well. Are you concerned, and I guess I'm going to direct this to the member of this panel that's responsible for child care, are you concerned that too much focus on federal mandates actually may be detrimental to the effects on children who might otherwise be raised with the intensive involvement and investment on the part of the parent or one of the parents for that child?
Thank you, Senator. for that question. Yeah, I think two things here. For one thing, children develop better in an environment where they can engage with others besides their family members, and allowing a child to be in a setting where they can develop the cognitive and the social emotional skills will allow the parents to go to work and not have to worry about their child falling behind by the time they're ready for kindergarten.
Let me just interrupt. Your first point was that, make sure I understand, you
Sure.
believe it's better for a child to not be in the home in their neighborhood with parents, with their parent. Let's say a 3-year-old or a 4-year-old child. They're better being in a professional child care center approved by the government than being in their home and in their neighborhood.
But it's more beneficial for the child because children learn better in a setting outside, well, with families first. Always the family is the child's first teacher.
I
But
didn't realize I was at a disadvantage because I was raised by my mom who stayed home. I guess what you describe is a perspective on the part of the administration, which I find contrary to personal experience and contrary to the perspective of many parents. I would think that as we think about the policies that we want to have with regards to child rearing, that we would give authority to the parents to make that decision as opposed to an administration to make it for them.
So, yes, well, Senator, again, parents are the first teachers, and a child's preference is to be with the family. But if the family cannot allow to do that, it's greatly beneficial for a child to be in a setting where they can get that support to develop their social, emotional, and cognitive skills. We have seen studies have shown that children outside of the family who are in group care setting do much better socially, emotionally, and cognitively.
Thank you.
So I know we don't want to defer for the nation to take care of a parent's responsibility, but it's a partnership, and it helps foster that child's development better than just being with the parent.
Senator Hassan.
Thank you, Madam Chair and Ranking Member Burr. Thank you to our witnesses, all of you, for being here today to discuss a really important issue. Expanding access to paid leave would help families across the country balance needs at home and at work. Madam Chair, before I start my questions, I'd like unanimous consent to enter into the record letters from 3 advocacy groups supporting paid leave.
Without objection.
Ms. Szabo, according to a report by AARP and the National Alliance for Caregiving, more than 21% of adults reported caring for an adult or a child in the previous 12 months. The majority of adults who have both a job and caregiving responsibilities reported making at least one change in their employment, such as cutting back work hours, taking a leave of absence, or leaving their job entirely to care for a loved one. The demand for caregiving is likely to only grow as our population is aging. So how do you believe that access to paid caregiving leave will benefit workers, their families, and our entire economy?
Thank you so much for the question, Senator Hassan. It's interesting that you asked this question. There was a study that came out just yesterday in the National Bureau of Economic Research showing that when caregivers have access to paid family leave, when a spouse has an injury and can't be working anymore, the paid family leave is correlated with more workforce retention for caregivers. And that's consistent with research from California as well, which shows labor force impact for working family caregivers who have access to paid leave, both in the short term and the long term. So if you think about it this way, you are in a family, there is a serious health condition, your child might have a disability, your child might get sick, might have cancer. You need to be able to be there with them in the hospital. The child will recover faster. The child or the person with special needs will get the care that they need. The person who is ill will get better faster. There are fewer medical complications. And the caregiver can either get back to work, or if long-term care is needed, they can help find a paid caregiver. And that's another piece of the care economy we need to pay attention to, a paid caregiver to help. These are families, these are people who are working middle-class jobs, low-wage jobs. They're doing everything they can to put food on the table, to keep paying the rent. Paid leave is a support that helps that. It helps people be financially independent. It helps them continue to work. It helps them to have higher earnings over time. And it's beneficial to caregivers, care recipients, businesses who don't have to bear the costs of turnover, who don't have to look for new workers, and the economy overall.
Well, thank you. I want to follow up a little. As we have discussed today, caregiving obligations disproportionately fall to women and can impact the number of women in the workforce. This has been exacerbated by the pandemic, with nearly 2 million women who left work in the last year still out of the labor force. In New Hampshire, an estimated 15,000 workers remain out of work in March because of caregiving responsibilities. So, Ms. Szabo, can you discuss how access to paid leave can help ensure that more women are able to participate in the workforce?
Absolutely. And this is an issue we saw long before COVID. It will be an issue that is with us past COVID. Women in particular bear disproportionate caregiving responsibilities for children and for older adults. What I'm really concerned about and looking at is we've now had this period of time where the gendered norms of caregiving have now been reinforced by the pandemic. The wage gap, cultural norms, expectations, dynamics within families have led to women doing disproportionate caregiving during COVID. Both women and men actually have provided care, and there's really interesting survey data that's come out recently on that. But women are the ones who have disproportionately left the workforce or cut down on their hours. I'm really actually concerned about the biases that then get reinforced as employers are then thinking about hiring, reinvigorating their workforces. What does that mean for their hiring decisions? What are the biases that they then bring as a result of this pandemic? And so access to paid leave that is gender equal will help to mitigate some of that. It will help to mitigate the costs that employers might fear. But I think we have to look really carefully at this. Retail, hospitality, these sectors that are bringing workers back on are bringing women back on in lower proportion to their share of the industry workforce.
That's helpful. Thank you. One more question for you. With COVID-19 vaccines widely available to adults, some workers have cited their lack of access to paid time off as the reason for not yet getting the vaccine. So that's why Congress included employer tax credits to help cover the costs of providing this leave time in the American Rescue Plan. Can you explain the importance of employees' access to paid leave in order to get the COVID-19 vaccine, and how the recent tax credits can expand this access to more employees?
Absolutely, and it was so good to see the rescue plan expand the purposes for which tax credits can be used. It's been good to see the administration doing outreach to small businesses to make sure that they know that those tax credits are there for them. But if a worker doesn't have a paid sick day, and 70% of low-wage workers don't, 25% of overall workers don't, they might not have time to go get a vaccine, and they certainly might not have time to deal with the side effects that we hear the second dose especially provides. And if you're fearful about getting that vaccine, that means you are continue to be exposed in your workplace. You might continue to put others at risk. So this is a public health imperative that businesses that are eligible for that tax credit use it, and that other businesses give workers paid sick days for the vaccination.
Thank you, and thank you, Madam Chair.
Senator Tuberville.
Thank you, Madam Chair. As we come out of this pandemic, our small businesses are in worse shape than they've ever been. And a lot of them are just hanging on by a thread, and they need every bit of help they can get, from the federal level. Mrs. Molito, why is now the time to add on another federal mandate to small businesses who are already struggling?
Thank you, Senator, for the question. So I would say that small businesses have done all they can to keep their employees safe, their customers safe, and their community safe, because it was about protecting the small business owner, him or herself, too. I mean, I'd say they played a critical role in helping get the coronavirus under control. They shut down their businesses, a lot of them. And offering leave, whether mandated or not, was the best way to protect their employees and their communities there. And they are now once again being called upon, as Ms. Szabo just talked about, to play a role in encouraging their employees to get the COVID vaccine. And at NFIB, we're doing all we can to educate our employees about that. But it's a huge challenge. Senator Casey talked about the public outreach. And the employer outreach is so important. Our survey shows that claiming those tax credits, this all sounds very easy and very nice, but the reality is it's very not. It's 70% of small business owners did offer their employees COVID leave under the Families First, but only 43% have claimed the tax credit out of those 70%. And the reason is it's just complicated. It's a hassle. And the IRS is now woefully behind in issuing reimbursement. So these were small businesses that were promised money, and now almost a year later, some of them still have not received the reimbursement there. So again, it sounds easy, it sounds noble, but it's incredibly difficult. But again, that said, small businesses by and large offer flexible paid leave benefits because it's the right thing to do, and they continue to do that throughout the pandemic.
Yeah, national paid leave program is another huge step, though. And, why can't states decide on a paid leave program for that works for them, Ms. Molito?
And that's a great question too, because, for larger employers, I can understand the enticement in having, in supporting a national paid leave policy that gives them preemption, all that. But, Ms. Szabo talked about, the benefits of employers and I think, states that have paid sick leave, New York, Rhode Island, Connecticut. I mean, those are just 3 states, they're blue states, and replicating what those states are doing at a national level is just unworkable. I mean, saddling our country right now with another national, federal entitlement program is just something that we cannot afford to do, and something that we've asked our members they would not support. Yes, there's overwhelming support for, paid leave programs. On paper, it sounds good, but when you ask how you're going to pay for it, support drops dramatically. And a Cato study from 2018 showed just how much it drops when you ask about, the trade-offs. Higher payroll taxes. People don't want that. Giving up raises. People don't want that.
Thank you. Ms. Mcmanus, we certainly appreciate your insight and experience dealing with this position from a large company like IBM. How would these same policies play out in a small business versus a large corporation?
Thank you, Senator, for the question. I think the issue for the large employer, as I've tried to articulate, is that we are in multiple states. And so it's enormously difficult for us, IBM, a technology company, to keep up with the rapid pace of legislation that's happening at the state and local level. And frankly, we want to provide a benefit that's uniform to all of our employees. It shouldn't matter what state you work in. From an IBM perspective and from the American Benefits Council perspective, these employers want to be equitable and fair to all employees. And frankly, it's really challenging for employees. They, as I articulated in my oral testimony, may be covered by many, many different laws. And that leads to a sub-optimization in terms of how they're using their benefits, which nobody wants. They have very generous benefits available to them because they work for these large multi-state companies, but they may not be using their benefits to the best of their ability because frankly, it's just too confusing for them. We recognize that small business has a different set of challenges, but we actually go back to the fundamental need of all American workers to have a level of protection for their own medical issues. They're taking care of their family when that's needed to happen. And we think that a federal standard leveraging on what's working now in the private sector is really the way to go.
Thank you. And we keep going back to talking about Social Security a little bit, about leaning on it and another small tax compared to that. You got to remember now, Social Security is almost broke. And we've overspent it, and we've not been very diligent with it. So I hope that we really consider taxing the American people and taxing, our small businesses at a very tough time, especially during this pandemic. Thank you very much.
Senator Smith.
Thank you, Chair Murray and Ranking Member Burr, and thanks to everybody on our panel today. It's such an important topic, and I'm just really grateful for the chance to hear what you all are saying. I'm going to direct my questions to Ms. Szabo, and this is what I want to talk about. So earlier this year, I had a really interesting conversation with Secretary Yellen about how we grow our economy looking forward and what impact workforce participation has on our competitiveness. And one of the things that we talked about was the challenges that women have faced in employment in the current economic environment. And she pointed out something really interesting, which is that women's workforce participation, the rate of workforce participation for women in the United States has typically been higher than in Europe until recently, when we began to fall behind. And one of the major reasons that we're falling behind in women's workforce participation is because of the lack of a national paid family leave policy in the United States. So as we discuss this is really, as we were talking about it, an issue of international competitiveness. So Ms. Chabot, could you just talk a little bit about this? Do you agree that a lack of a national paid leave policy is contributing to lower workforce participation rates and has an impact on our overall competitiveness?
Absolutely. There's many studies out there, many analyses that show reduced labor force participation among women and among caregivers when paid leave is unavailable. There's quantification, a loss of $500 billion to the U.S. economy that predated COVID. Conversely, if we had a national paid leave program and other policies that promote women's labor force participation, McKinsey estimates that we could grow our GDP by $2.4 trillion by 2030 if we put policies in place now. AARP just did an analysis showing that we could add $1.7 trillion to GDP if we supported family caregivers. Obviously, there's some overlap in those two modeling models to show that. But the bottom line is, yes, our labor force participation had been dropping prior to COVID. Our women's labor force participation is now at nearly a 40-year low, with women's labor force at levels not seen since the 1980s. So obviously some of this will be alleviated as the pandemic ends, but we have to solve this problem if we want to have the kind of competitive economy in the global marketplace.
This question is not an abstract question all across Minnesota, where I talk to business owners across the spectrum who are telling me, regardless of what industry sector they're in, they're telling me about the significant challenges that they are having to find workers to fill the jobs that they want to create. This could be in the ag sector, in the service sector, in the healthcare sector. This is a story across the board. And so, you know, I've heard some of our panelists and some of my colleagues suggest that a paid family leave policy, perhaps, you know, like what we would propose in the Healthy Families Act or the Family Act, that we just can't afford it, that it's too expensive. So how do you square that argument with this competitiveness issue that we're talking about, Ms. Chabot?
Well, I just think there's no data to bear out any of these arguments. And paid sick days and paid family leave operate a little bit differently. But with respect to paid family leave, we know that the certainty that's created by workers having access to paid leave benefits both workers and especially small employers. We know that in states that have a contributory payroll contribution model, this creates the predictability and certainty for employers so that they can mitigate their costs, so that they can hire replacement workers if they need to. With respect to paid sick days, where there is a direct cost to providing the earned benefit to workers a few days a year for sick time, there is no evidence from any state or city that this has contributed to job loss or wage declines or inflation or the reduction of other benefits. So I understand the theoretical concerns, but these are not borne out by the data, and we now have, you know, a decade or more of experience with these policies. And this sort of idea that blue states are somehow different, it doesn't really pan out when you're looking at states that have large and diverse economies, as the states that have paid leave do.
You know, I was once the owner of a small business myself, and I can appreciate that small businesses are different than large businesses. But I also can appreciate that it is almost impossible for a small business to try to solve this kind of a problem on their own if they want to offer paid family and medical leave. And that's why I think solutions like the Family Act or the Healthy Family Act are the right solutions. And especially when you think about the significant, dramatic inequity with less than 1 in 3 low-wage workers having access to a single paid sick day, while high-wage workers in this country, in the private sector, 94% of them have access to paid family and medical leave. I think it really demonstrates the inequity here also. Thank you, Madam Chair.
Thank you. Senator Braun.
Thank you, Madam Chair. Interesting discussion, because running a small business for so many years and the idea of paid family leave makes sense. I think it's another thing that if we could just afford to do it, it would be nice to have it. And I can see the proposal currently out here doesn't sound like a lot. Currently, I think employers and employees split the burden of Social Security and Medicare 7.65% each, 15.3%. This adds a small percentage, but I think my question, since the merits of paid family leave is not, in my mind, that debatable. It'd be nice if we could have it, if we could afford it. It does beg the question that in the drivers currently of payroll taxes, Social Security, and Medicare, I think we got 5.5 years before the Medicare trust fund is depleted. We've been paying into that since the 60s. And the Social Security trust fund, I think, has got 12 to 13 years. But to me, you probably wouldn't even need to put any more burden on employers and employees if you could just bring those two programs into some type of fiscal order. Healthcare, for instance, is to where we can gain the most dividends if we just embrace competition, transparency, get rid of the barriers to entry, get an engaged healthcare consumer. You could bring that trust fund probably back into solvency quickly. Social Security, we know the variables there too. You're going to need to probably raise the age at which you're going to be eligible for it, means tested. Don't think that you're going to get very many people wanting to put heavier burdens on employers and employees. My question is for Ms. Molito. What do you think, through the eyes of the NFIB, not on the subject matter of paid family leave, what do we do with the two big issues in the room? Where is the NFIB on addressing Social Security and Medicare costs? Because it's going to make all the rest of this a moot point soon.
Thank you, Senator, for that question. And certainly the unfunded liability with regards to Social Security is something that our members have expressed concern about. And that is why they are very concerned about any additional taxes or burdening the Social Security system anymore with what I said would be essentially, depending on the proposal, a new federal mandate. I mean, again, we all want to be Santa Claus. It's nice to come up with these great, robust benefits, as, I think one of the witnesses called them there. But the reality is that not all businesses can afford to offer the same plethora of benefits. And it sounds nice, but they just can't do it. But most of them do it because it's the right thing to do. And that is how they retain and attract the best talent out there. They are competing with IBM, and it's hard to do it, but they're managing to do it. And, again, a big part of our economy is small businesses. So we need to consider small businesses and the imposition that a new mandate would have on small businesses, both the employers and the employees. And what is it that these small businesses and they can afford to offer, and what is it their employees want? I was talking to a business owner last week. He's an HVAC operator, desperately trying to hire new employees. His candidates are looking for money. That's what he said. It's about money. It's about cash. I don't think he has candidates necessarily that are coming in asking for paid family leave or paternity leave. Not that those are not good benefits, but right now he's got candidates that are asking for top dollar. That's what they want, cash in hand. What's your bonus at the end of the year? Maybe they're asking about vacation time, but they're not asking necessarily.
Real quickly, before we run out of time, I know that the NFIB is behind transparency ideas on health care. When it comes to Social Security, in terms of means testing, raising the age, some of the more difficult questions, and we got more time for that, does the NFIB have any position on what to do with it?
We would be happy to study any proposals, Senator, and we would get back to you on that.
If we can't grapple with that discussion, to me, it's a moot point on any of the rest that would be good ideas that would be ignoring, what's going to occur with those two trust funds being in big difficulty soon. Thank you.
Thank you. Senator Rosen.
Thank you, Chair Murray. I appreciate this hearing. Thank you for everyone for being here today. Really appreciate you. I really want to talk about making paid leave work for small business owners, because that's really the crux of what we have to do. That's what all of these conversations boil down to. So, Ms. St. Hilaire Finn, I'm pleased you could join us today, really to offer your views as the owner of your own small business, and also I understand as a member of the Main Street Alliance, an organization of more than 30,000 small businesses. Myself, I'm a member of the Help Committee, but also the Senate Small Business and Entrepreneurship Committee, and I represent Nevada, where small businesses make up over 99% of businesses in my state. And so I think it's critical that we bring workers and small business together to find these pragmatic solutions that provide real relief for working families, particularly as Senator Smith talked about the women's labor force, that decline. It is really concerning that we lose the women's talent in the marketplace. So you've noted your support for the Healthy Families Act, Chair Murray's paid sick leave legislation. I'm proud to be a co-sponsor of that. So as a small business owner and a member of the Small Business Advocacy Group, can you tell us more why you think the approach in this specific bill will work well for small businesses?
And thank you, Senator Rosen. As a nurse and as a childcare owner, it is clear that we need a common sense paid sick day standard like the Healthy Families Act to ensure that all employees have access to paid sick time without losing wages or their job. Also, without sick days, workers show up to work sick, costing us all more in the long term, or they stay home and risk losing their jobs, which costs the economy as well. Paid sick time is a basic minimum work standard, like workplace safety or the minimum wage. We all do our part and we will all benefit. Also, studies of cities where paid sick day policies have been implemented show that small businesses can adapt and support the program.
Well, thank you. I really believe that all of our communities, what's the backbone for everything in this country? It is our families and how we care for them. So it is really important. And so what do you think the federal government, how could we provide any more useful resources to small businesses about offering these paid leave policies, maybe through the SBA or Department of Labor?
Thank you again, Senator, for the question. Now, small businesses need extra help finding out more about these programs. The typical small business has no HR department and limited resources. So we need an intensive outreach and education effort to reach small businesses well in advance of programs being launched. Okay, I found out a lot about Families First from Main Street Alliance. Engaging small business organization should be part of this effort. This will also help small business compliance and also help ensure that more employees find out about and can apply for the program.
Thank you. I appreciate that answer. I really like to turn to some of the benefits of paid leave to business. So Ms. Mcmanus, I'm going to direct this question to you. And again, Senator Smith said we could grow our GDP maybe by over $2 trillion if women re-enter the workplace. So I know this is going to be important. So Ms. Mcmanus, I'm pleased to see the American Benefits Council that you have a statement on the principles of paid leave, and that many of your members, of course, do provide paid leave to their employees. And I really recognize and appreciate that the number of employees in this country, they're really doing their best to keep their workers, their families, their communities safe and healthy. I'm really glad you brought this perspective here today. So can you tell us about the benefits that your members have seen from voluntarily offering paid leave benefits, especially during the pandemic?
Absolutely. Thank you, Senator, for the question. IBM has had a long history of commitment to developing programs to help employees better manage their work, their family, and their personal responsibilities. And frankly, we think that's key to having an engaged and productive workforce. And I think that that is a shared sort of vision for the council companies as well. Our programs will offer solutions around, dependent care, medical care, care to take care of a family member, I would bring up, as you did, the pandemic. We had to really quickly sort of enhance our package in recognition of the public health emergency to provide for backup care, for example, for folks who are caring for children, schools were closed, or elderly or other relatives who needed care and the caregiver could not be available. What we saw, which was quite dramatic, we measure engagement all the time at IBM, and what we found was our engagement score actually went up by 3 percentage points in 1 year. And that was the year when everyone was traumatized with the public health emergency. Why? Because our employees felt supported. And when they feel supported and they're more engaged, they're better at their jobs. And that is good for American business.
Well, thank you. I see my time's expired. That's a great note to leave it on. Workers have families too. Thank you.
Thank you. Senator Lujan.
Thank you, Chair Murray and Ranking Member Burr, for holding this hearing and to discuss the importance of expanding access to paid leave to support families. And thank you to our witnesses today for making yourselves available and for making a difference. Ms. Szabo, Latinas are typically paid just 55 cents and Native American women just 60 cents for every dollar paid to white non-Hispanic men. This wage gap illustrates the high cost women pay for our nation's leave policy failures, especially for unpaid time spent out of the workforce. The United States offers little support for working caregivers, especially paid family and medical and sick leave. We need a national policy now, not only to close the wage gap, but to boost our economy and recover from this pandemic. Ms. Szabo, would enacting a federal paid leave policy help to close the wage gap for women?
Yes, sir. Great question, Senator. And these issues are so inextricably connected. So women are more likely to take leave if they're in a two-parent family or if they are part of a larger family with male siblings and female siblings because of the wage gap. That means that they have lower earnings over their lifetime. That means they have more work interruptions. So there's an inextricable link, and it would help to close the wage gap if we had paid family and medical leave, particularly for Latinas.
And you state in your testimony that critics of new spending focus on what paid family and medical leave will cost rather than on costs already borne by society. Ms. Szabo, how many women have lost jobs since the start of this pandemic?
4.5 million women have lost jobs overall, and 2 million have still not returned to the workforce.
And you also state that paid leave would strengthen our economy. And according to the National Partnership for Women and Families, how many jobs could the United States add to its labor force by enacting a national paid leave program along with affordable childcare?
Yeah, I believe we could add, or the National Partnership estimates we could add 5 million jobs. Paid leave and childcare are both job creating, job enabling, and job enhancing. And that translates into GDP increases for the whole country, as well as greater economic security and retirement security for families.
Now, you mentioned GDP. Nationally, how much GDP could we add to our economy if a national paid leave policy were in place?
So pre-pandemic, DOL estimated $500 billion. Along with other interventions to help close the gender gap in occupation and work, McKinsey estimates $2.4 trillion. So we're leaving a lot of money on the table by our unwillingness to enact these policies.
Appreciate that. Thank you so much for your responses. A national paid sick days and family and medical leave law would enable millions of working families, including Latinos and Native Americans and African Americans, to not have to choose between their health and a paycheck. I'm a proud co-sponsor of the Family Act and the Healthy Families Act, which together create a national paid leave program to provide workers with up to 12 weeks of paid leave and 7 paid sick days a year. However, without these laws, we see huge disparities in workers' access to paid leave. Latinos have the highest labor force participation rate and are the fastest growing segment of the workforce, yet they are the least likely to have access to paid sick leaves. 50% of Latinos report having no access to paid time off, compared to 34% of white workers, and Native American workers are 100% less likely to take leave when needed, according to the National Partnership for Women and Families. Ms. Szabo, yes or no, are workers without paid sick days and family medical leave disproportionately African American, Hispanic, and Native American?
Yes, they are.
And Ms. Mcmanus, your company provides generous paid sick, family, and medical leave benefits. Why did your company choose to provide these benefits, and how has it impacted your business and workers, especially workers of color?
Thanks for the question, Senator. Well, IBM, and like many employers, decided to offer these benefits because, one, we recognize that there's a fundamental need for that people do need time off to take care of themselves and their family members. Secondly, we are in a competitive talent market, and we know that we need to offer an attractive package in order to attract the best and brightest to come and work for IBM and the companies that I'm representing today in the American Benefits Council. So that's another reason. And I think I referenced earlier that, we see a huge uptick in our engagement, which is really tied to productivity and also to retention, right? To keeping our employees on the job and happy, doing their job, doing their best job by offering these types of programs. If we're there when they need us, then they really want to stay and they want to do their best job for us. So it's really good for the business as well.
Thank you. And Chair Murray, my time's expired. I do have a question for Ms. Hilaire Finn, but I will submit it to the question to just learn more about what this would mean to her business and employees with the national paid leave policy. So I apologize I could not get to it, but I'll make sure I submit it to the question and look forward to learning from you as well. Thank you, Chair Murray.
Thank you so much. Senator Hickenlooper.
Thank you, Madam Chair. And I want to thank each of the panelists for their the time taken, not just to be here today, but for all the preparation and for all the work they've been doing. Let me start, Ms. Chabot. Last year, in the midst of this coronavirus pandemic, Colorado voters, so this is a statewide voter initiative, overwhelmingly chose to create a statewide paid family and medical leave program. I think, to my knowledge, the first state in the country to do this by a ballot initiative. I thought what was really unusual about this was that the support was high all across the state, across all demographics in, highly Republican El Paso County, in highly Democratic Denver County, but also with voters in urban and rural areas. And I thought I'd like to, if you could just speak a little bit more about the benefits of paid leave and paid sick days for people who live in rural areas like the Eastern Plains of Colorado or some of the mountain towns in Colorado.
Certainly. And yes, the Colorado victory is a huge testament to the bipartisan appeal of this policy. It's been true in polls nationwide and in every state, but Colorado was the first test of that at the ballot, and it was wonderful to see that happen. Colorado also adopted a paid sick days law in the middle of the pandemic through the legislature, so congratulations to your state for being a leader, Senator. I'm glad that you bring up this question of access in rural areas. We know that paid sick days workers are less likely to have paid sick days in rural areas. They're less likely to have paid family and medical leave, and yet the distances that rural people need to travel to get to healthcare, to visit a loved one, to seek a specialist's attention or input, the distances are higher. Access to care is harder to get. And for parents, access to infant care is more difficult because of childcare deserts. So there is a huge need in rural areas, and that really speaks to why a paid family and medical leave program is important, not just for people in cities, but really across the country.
Well, thank you, and I couldn't agree more. And I do, when you see a voter initiative like this do so well across all demographics, on a bipartisan level, you do begin to get a sense that this is an issue that's ready for a national solution. Ms. Hilaire Finn, and I'm also a former small business owner, and certainly I always, like almost every small business owner, I wanted to do right by my employees, but I was always cognizant and being aware of the costs of those efforts. Last year's COVID relief package included tax credits for small business owners, middle-sized business owners who provided paid leave. How did that impact your small business costs, and what lessons to policymakers? What did you learn about how to design a national paid leave policy based on your experience over this past year?
Thank you, Senator, for the question. Well, what COVID taught me, and I think other small businesses, is a cause for paid national family leave. We had to cobble together different funding to allow families or employees to take time off to feel comfortable coming to work and being exposed to a virus. So as a small business, what I learned is that having the Family First Cares Act really helped. It was pretty much a lifeline for us, as I alluded to, because without that, I don't know how I could reassure my employees that they could take time off when we were exposed to the pandemic, that they would have gotten paid to continue to provide meals and shelter for themselves and their families. So I think what this has taught me is that we need this on a national level. We can't afford to continue to charge high fees just because only some can afford it, but also on a national level that all business would have access to provide paid sick and family leave. So this is what it taught me. More so, we've been exposed. This patchwork of emergency just because of a crisis, we should have this on a permanent and everyday level where workers, especially low-paid workers, can feel security in their jobs and the work that they perform.
Right. Well, we agree on that. Appreciate that. And again, I want to thank everybody for putting in the time on this panel. I yield my time back to the chair.
Thank you. Senator Burr.
Thank you, Madam Chairman. Just one last question. I'll direct it to all of our witnesses, and it's really a yes or no answer. Federal government allows its employees to use comp time or flex time. In other words, comp time for federal employees is 1 paid hour off for each 1 hour of irregular or occasional overtime that's been worked. For example, if you work on a Saturday, which is an irregular time, for every hour you routinely would have an hour off. Then you may be compensated for that time. Here's my question. If the benefit's good enough for federal, state, and local workers, wouldn't it be fair to allow private sector workers to get the same generous comp time benefit? Ms. Sherrill, yes or no? No?
No, people shouldn't be required to trade off time and money. They need both.
Marcia?
I concur, they need both.
Ms. Mcmanus?
Could be part of a solution, not necessarily the only solution. I know that wasn't a yes or a no, Senator.
Ms. Molito?
Yes, NFIB supports that flexibility.
Well, we're beginning to build the bank of solutions. I thank each of our witnesses. I thank the chair.
Thank you, Senator Burr. Ms. Szabo, I just had one other question. You alluded several times to the millions of women who have left the workforce during this pandemic and have not yet returned. Oftentimes, that is women of color, women in low-wage occupations, as you talked about. Clearly, our economy is not going to fully recover from this pandemic unless working women recover. And to me, that means better child care and national paid leave policies. Can you comment on that?
I 100% agree with you. I think we have for too often failed to invest in a care infrastructure or a care economy that recognizes that people have personal lives and people have work lives, and they are inextricably connected. And we cannot go back. We have to go forward, and that involves investments in paid leave, investments in childcare, investments in home and community-based care. Just like roads and bridges, this is essential for people to get to work, stay at work, and be successful.
Thank you. I ask unanimous consent to put in the record 5 letters in support of national paid family, medical, and sick leave policies from individuals and groups, including advocacy groups for workers, women, and families and stories from workers around the country, without objection. That will end our hearing for today, and I really want to thank all of my colleagues for the thoughtful discussion. I want to thank all of our witnesses, Ms. Szabo, Ms. St. Hilaire Finn, Ms. Mcmanus, Ms. Molito,